Coughs and colds in children are very common. We frequently end up taking them to the pediatrician and they constantly have a runny nose. But sometimes, if we find that children are getting frequently nose block, a runny nose, mouth breathing, and sometimes they may even be complaining about ear pain, these are scenarios where one should think about other possible diagnoses. Between the age of 2 and 10, all of us have a gland at the back of our nasal passageway called the adenoids. And like the tonsils, the adenoids have a tendency to swell up. Now when that happens, it obviously will block the breathing passage and we will end up opening our mouth and breathing. We might even snore. But it can also cause a collection of the mucus which doesn't drain out, and the children will have a constantly runny nose, frequent colds. And unfortunately, this is the exact area where the eustachian tube, that is the tube connecting the ear and the nose, opens up. So this can cause a blockage in the eustachian tube, and children may constantly complain of ear pain. They may even notice that there is some amount of hearing loss. Now these are common problems, but they have simple solutions and they can even be preventable. All we ideally need is a simple ENT examination, and in some cases, the use of some newer technologies like a small camera to look into the nasal passageway, or a simple hearing test to check whether there is any fluid behind the ear. Most of the times the treatment is medical, including some sprays, some syrups. But in some scenarios, if the problem is a little more severe, then the use of some newer techs, something called a cochleator, to remove the adenoids comes in very, very handy. Sometimes we may even need to do a small procedure to remove the fluid behind the eardrums, but frequently, if it is diagnosed early, it can be solved easily. Thank you.